Thank you. So, yes, I primarily belong to SGPGI, and hopefully in another 1 year's time, I'll be back at SGPGI. So I look forward to that. So the topic that I have been given today is, why do we need ethics guidelines in medical research? As and when I am asked to speak on something, I first look at the title and see what are the main things there are. And so this topic deals with ethics and with medical research. So I'm going to spend a little while talking something about ethics, something about medical research, and then look at the intersection of these two fields. So ethics is a word that is very difficult to define, but what you would find in a dictionary is a discipline concerned with what is morally good and what is morally bad, what is right, what is wrong. Some other dictionaries define it as a set of moral values an individual establishes for oneself and for one's behavior. And the word is actually derived from the Greek word ethos, which we do something similar we use in English, which stands for the guiding beliefs, values, and ideals that characterize not only an individual, but a group, a community, a nation, a country, etc. So when we come or talk about research ethics, this is the intersection of research, in our case, biomedical research with ethics. So it deals with all the moral issues that arise during or as a result of research activities. And you heard about the result about publications, as well as the conduct of individual researchers and the implications for the entire research community or a biomedical research community. So if we look at ethics, sometimes we think ethics and law are the same. No, they are not. There's a major difference between ethics and law. Law is much more formal. Ethics are much more informal. Law is something that the society lays down. Ethics is something that is much more individual or in small group in nature. Laws are all encompassing. So a law, if you look at this slide, means a systematic body of rules that govern the whole society and the actions of its individual members. Whereas ethics is more of a philosophy, moral philosophy that guides individuals about their basic human conduct. Laws are generally much more specifically written down set of rules and regulations, which are usually set up by the government. They are expressed and published in writing. Whereas ethics are a set of guidelines that are more informal. They may not be written down. They are abstract. People are expected to act on those, though they may not be written down. Violation of law is usually not permitted, and if it happens, then it leads to punishment, which can be fine, imprisonment on both. Whereas in ethics, there is usually no punishment, though there are things that come somewhere at the interface between law and ethics, and there could be some penalty, punishment, which is not in the form of imprisonment, fine, but it could be in some other forms. You surely lose face. People don't like you. That definitely happens. So that's what the last 2 points also says. Ethics are meant to help people decide what is right or wrong, whereas law is much more clear and much more essential to maintain social order and peace, etc. in the society. There have always been ethical principles for doctors. So as early as 4th century BC, we had Hippocratic Oath, which is primarily that physicians should do no harm. Similarly, in other cultures, other societies, there have been books, there have been principles that have been laid down. Biomedical research is the second thing that we look at. It is been existed for much before it has existed for several centuries, and initially it was mainly observational, and over time it has become interventional. Studies have taken over. I'll give you some examples of studies that have been done olden times and now, and we see how ethics apply to them. So there is this study by a person known as James Lind, who lived in the 18th century, which is believed to be the first clinical trial. And this is how he described his research in his own words. On 20th May 1747, I took 12 patients in the scurvy, meaning those who had scurvy, on board the Salisbury at sea. So this was a ship that he was commanding. Their cases were as similar as that could have them. They all in general had putrid gums, the spots, which is petechiae, and lassitude, which is malaise, with weakness of their knees. They lay together in one place, being a proper apartment of the sick in the forehold in one part of the ship, and had one diet common to all, and it describes that. In addition, so he divided these 12 people into 6 groups of 2 each. They received cider, sulfuric acid, vinegar or acetic acid, seawater, oranges or lemon, or a spicy paste plus a drink of barley water. And then he talks about his observations. Treatment of group 5, those who received oranges and lemon, stopped after 6 days because they ran out of fruit on the ship. By this time, one of these 2 sailors who was getting oranges or lemon was fit for duty, and the other had almost recovered. Apart from that, only group 1 showed some effect of treatment. So this was a clinical trial, supposedly the first clinical trial ever done. Let's look at this. If we were to do a trial like this, will it be acceptable today? Anyone from the audience wants to say what are the problems they see with this trial? Any of the students? Vinita, can you help pass the mic around if possible? If not, I'll go on. Okay.
Consent is not from the patient.
Say it again, please.
Proper consent is not taken from.
Okay, good, very good. Any other shortcomings in this trial? Okay, I think that seems difficult. So let's look at this. So if we look at this, there are several things. Some of them relate to research methods and some of them relate to ethics. There were too many treatment groups, 6 of them, and very small sample size in each group, only 2 observations. There was no random allocation. There was no blinded assessment. It was his subjective assessment. And we don't know whether he took an ethics committee permission. I would think no. Consent, we don't know. These subjects were his subordinates. He was the commander of the ship, and these people working on the ship, they had no other choice. They had to be a part of his experiment. And of course, if some of you know about trial registration, there was no system of trial registration at that time. Do we think this was okay to do? Till today, people haven't really raised questions about ethics of having done this study. And we know thousands of sailors around the world have benefited from the results of this trial. I can also tell you that for a few years, about 20 years, nobody acted on the results of this trial. And that is when they introduced citrus fruits and the disease virtually disappeared, and it's no longer a problem among the people who are on voyages. Now let's look at another study. All of us know about Edward Jenner. We think he did something great. What did he do? He had this woman whose name was Sarah. She was a milkmaid who had cowpox lesions on her arms. At that time, already people were using variolation, which means they used to take something from smallpox lesions and they used to apply a small amount to people, and that used to prevent smallpox. But the problem with variolation was that it was toxic. Some people used to develop smallpox and actually die with that kind of immunization. And he found that these milkmaids would not get smallpox. So he suspected that cowpox was preventing smallpox. He took fluid from the lesions on this lady who had cowpox lesions. He inoculated an 8-year-old boy, the son of his gardener, with this cowpox serum taken from those blisters. He developed a mild illness, cowpox. He had fever, he had some other symptoms. Now, he thought that this boy, having been exposed to cowpox, would be protected against smallpox. So he took scabs from a smallpox patient, those are shown in red here, and he applied those, or he exposed this boy to those, and he found that he did not develop smallpox. And this is how he did. Having done this, over the next few months, he tried it on total of 23 persons, mostly children, and including his own son, who was 11 months of age. Do people think this was acceptable? There are several issues here. By today's standards, this would not be acceptable. Exposing people to smallpox would be difficult because that's possible. It carries a risk. He did this in a child, in the child of his employee who could not have resisted, and first tried it on other people. And having shown that it works, it could be alleged that he went to his boy after he had done it for others. So there are problems. However, again, we don't talk about it today. Nobody says what he did was unethical. And part of it is because ethics change over time. Over time, our beliefs and values change, the relationships of people change, what we expect individuals to do changes, and our behavior changes. And ethics of biomedical research have also evolved over time. So some of these things that were done years ago, today we are not questioning them. But things change over time. Let me show you some other examples of studies. So this is a study done in 19th century on bloodletting. For many diseases, the treatment was bloodletting. They would cause an incision, remove a person's blood, and think that bad blood is gone and the person should improve. This is an observational study, and they said it had been so arranged that people who were admitted to 3 different areas, so that each had 1/3 of the patients. The sick were indiscriminately received and were attended as nearly as possible with the same care and accommodated with the same comforts. 1/3 of whole were soldiers of the 61st Regiment, the remainder of my own. So that's just a description. And they had 3 groups, one treated by Mr. Anderson, one by this author, Mr. Hamilton, and they did not use the lancet, they did not do bloodletting. And in the patient that they looked after, 2 and 4 died, whereas the 3rd surgeon who was into bloodletting, 35 died. And so research methodology evolved. People started bringing in control groups, comparison. Similarly, we come 50 years down the line, middle of the 19th century, there were 151 boys where I had tolerably satisfactory evidence that they had scarlet fever, divided them into 2 sections, taking them alternately from the list. So you see, trying to make groups equal, moved from overall to alternate patients to prevent the imputation of selection so that there is no selection bias. To the first section, I gave belladonna. To the second, I gave none. And they found 2 in each group had something. The numbers are too small to justify deductions. But if I had given belladonna to all the boys, I would have probably said that the epidemic improved because of belladonna. So they tried to learn that you needed concurrent controls and not historical controls. Something similar happened in this, and I'll skip this for the time being. Okay. Or maybe I'll take you through. So this is something, so they were using antitoxin serum for treating diphtheria. And this physician said he took adult patients and decided that it is not antitoxin serum. Even if they gave ordinary serum, people may improve. So he alternately treated people with 2 kinds of treatment, but did not do it for children. So we see a concept coming in early 20th century that experimentation should happen with adults and not with children. And then after 2000, in the later half of 2012 and first half of 2013, I gradually lowered the age of those to be treated with ordinary horse serum. So now once he was clear of results in adults, he could move to children. And then he comes to similar conclusion that you cannot compare results from different time periods, and that would lead to wrong conclusions. And he said, to make the trial as objective as possible, I have not relied on my own judgment alone, but have asked some other physicians to. So we start seeing blinded observation. Okay, so we start seeing that science evolved. So we moved towards randomized, controlled, blinded trial. So in 1950s, the trial was to be done of the SARS polio vaccine. And these are documents from there. The use of a placebo-controlled group seemed to be too much of a calculated risk. And they thought that if we were to ask people that some people will get a placebo, parents, teachers, and health officials will reject that possibility. However, Salk believed that if we were able to do this, it will be a beautiful experiment over which epidemiologists would be quite ecstatic, but which would make the humanitarian shudder. Meaning it seems inhuman to do this, but epidemiologically it could be a fantastic study, because by that time they knew that we needed controls, and there were observations that were showing us that we needed to do randomized, controlled, blinded trial. So I think this illustrates really why we need ethics. We want to do something so that we can come to correct conclusions in science, but at the same time, this is something that does not seem to fit into what many of us would consider acceptable. And we need to have principles which allow us to do good science while at the same time making it people more comfortable. Let me bring you further in time. So there was this gentleman doctor called Senerelli in Italy who went and worked in South America, and he isolated an organism, a bacterium that he thought caused yellow fever. He injected this bacterium into 5 persons without their consent, and 3 of them died. And this is actually the first time that there was a major public debate on medical ethics, and he was extensively criticized. How could he do this? Inject something into 5 people without consent. But remember, we talked previously of Jenner having exposed people to smallpox because the results were good, so nobody criticized him. Anyway, so this is what happened in 1897 with him. And then we come to Walter Reed, a famous researcher. A lot of US research institutions, biomedical research institutions are named after him, including the US Army's Walter Reed Institute. In 1901, he started a study because he learned from some Cuban doctors that they suspected that yellow fever was transmitted by a particular type of mosquito. Till that time, the belief had been that yellow fever was transmitted by direct contact between people. So he asked people, sorry for that incomplete sentence on my slide. He said, we would have mosquitoes that will bite a person with yellow fever and have volunteers getting bitten by these mosquitoes. For this, he advertised for people who would volunteer to be bitten by mosquitoes that have bitten a person with yellow fever some time ago. And he offered people, if you see this red box here, $100, and this is the consent form for one of those people. This is the first example in the world in the year 1900 of informed consent being taken, and he promised them $100 each. And by this, he proved that yellow fever was transmitted through mosquitoes. This led to setting up of mosquito eradication programs in Central America, in Panama, for instance. And that is what allowed the completion of work on Panama Canal during the years 1904 to 1914. Before that, a lot of people for years had tried to make Panama Canal. It has been unsuccessful because in the forest there, whenever people went to work, they would get yellow fever and they would die and the work would stop. So that is the contribution that he had to the word economy. With Panama Canal, the word changed. But even though this may seem okay, it was thought to be a major advance because he asked people, he took their consent. It was not like the Cenarelli's experiments where he did it without consent. He did it with consent. But today we know that a lot of these people could have done this. 100 US dollars in 1900 was a large amount of money, and they could have done it for this money rather than otherwise. So, as I said, the yellow fever experiments were the first time that ethics came into prominence, or there was a public outrage. But the maximum outrage has been after the Second World War, based on what the Nazis did. They did a lot of research during the Second World War. So they had these huge concentration camps where they had people who were Jews, people from Poland, and many other nationalities. They killed them. They did biomedical experimentation. Their experiments were something like this. They wanted to see what happens at high altitude. A part of it because they wanted to make sure that their soldiers, when they fight the world, are in the best possible shape. So they put the prisoners into low pressure tanks to see how long they could survive in the absence of or in the shortage of oxygen. If they died, they did autopsies. If they did not die, then they added water to those tanks till they died and then did autopsies. They exposed them to cold. Sorry, there should be freezing water here. And then they would try to rewarm them. Many of them did not survive on rewarming, and they would do autopsies to see what is the injury that happens with freezing. They did infect some of them with malaria, trying to test anti-malarial drugs. Some of them died of adverse events of the drugs because these drugs were toxic. Others, the drugs were unsuccessful. They had malaria of variable severity and some of them died. They tried to do test treatments for mustard gas, which was something that was commonly used in the war that time, to see whether they could develop antidotes to mustard gas. But of course, those who were exposed, many of them died. Wartime injuries were common and how to treat them was not clear. So they did experiments by inducing injuries and trying to try whether sulfanilamide, which was they did not have access to penicillin then, whether that would work. So again, controls were those who had not been given sulfanilamide, and they tried this. They were trying to develop vaccines against typhus, another infection that would create problem during wartime. So they gave people anti-typhus vaccine and others were not given, and then they were exposed to typhus. They tried various poisons. They burnt them with bombs and tried to see whether their injuries could be improved in a certain manner. They also believed in eugenics, and they did not want people with certain beliefs to reproduce. So they tried different methods of sterilizing them. They did experiments on twins. And this is something that I wasn't aware of till recently. And they would take twins, expose one of them to the pathogen and not exposing the other one to pathogen, treating him as control. And if the experimental one of the pair died, they would also kill the second twin and do autopsies on them so as to compare the effects of various things. They even tried to create conjoined twins by sewing twins together. This would often lead to gangrene and death. These were horrible experiments, but they were done by doctors nevertheless. One may say under the control of the army, but they were doctors nevertheless. At the end of the Second World War, there were Nuremberg trials, and also there was a lot of discomfort that people had. And finally, a court in the US, so this was not in the original Nuremberg trials, but subsequent trials it held in the US. Some principles were laid down, and this was called as the Nuremberg Code. And I'm sure you'll hear from other people in the course about this. Some people believe that's actually not the US code that laid it down. Many of these principles were actually being laid down by the German physician community during the Second World War, those who were opposed to the kind of experiments that were happening. Nuremberg Code has 10 principles. They talk about voluntary consent, experiment being so designed that it should give results for the good of the society and which cannot be done in any other manner. The experiment should avoid any unnecessary physical or mental harm. It should not be conducted if you have a prior reason to believe that it will lead to disabling injury or death. The degree of risk should be such that it is justified by the importance of the question that you are trying to address. You must take all possible precautions to prevent injury, disability, or death if there is a small risk. And study should be done by those who are best qualified and not just by anybody. There should be a possibility for the person to walk out of the study, as also for the researcher to stop the study if it appears that there is a problem in continuing the study. Now, one may think that Nazis did all this, but friends, actually such studies have been done in other parts of the world, including in United States of America and other developed countries, and around the same time. And let me show you some examples. And that tells us why we need ethics. So there is this famous example that you'll hear about in ethics all the time, the Tuskegee syphilis study. This was a study started in 1932 by the US government in collaboration with a university, which was a university primarily for the blacks. And it was thought that they would be interested in protecting the interests of blacks. They enrolled 600 African American men who were working in people's fields and would get a share of the crop in an area where syphilis was particularly common. Of these 600, nearly 2/3 had latent syphilis, and the remaining 1/3 were thought to serve as controls. And the original study said that they will be observed for 6 months to understand the natural history of syphilis. The incentive was that they were promised free medical care. That was a time when free medical care for these people was not easily available. So this was some kind of incentive for people to maybe undue incentive. Already there were data from Europe on natural history of syphilis, but their hypothesis was that this might differ in blacks compared to whites, so it is important to study. And the previous data had been from retrospective study that we will get data from prospective study. Whether those are likely to be any different was not very clear. These subjects were not informed that they had syphilis. They were told that they had bad blood. They were observed for 6 to 12 months when they were supposed to be treated. They were given some weak treatments because the treatment that was known at that time, arsenicals, were too costly, and they were continued to be followed up. They were followed up for about 40 years till 1972 when a scandal erupted. Penicillin had widely become available in 1947 and was the standard treatment for syphilis. These people were not offered this treatment and they were followed up without treatment. And this is something that is, they harmed people who were on follow-up, for whom they knew that they had had syphilis infection in the past and they could have been treated and further progress prevented. Then there are these studies called Willowbrook studies, which are closer to me, which I know better about because these were in the field of viral hepatitis, the area that I work in. There was this institution called Willowbrook State School in New York City. It existed, it was set up in 1947 and existed till 1987 when it was closed down. It was a place where children with intellectual disabilities, Down syndromes and other intellectual disabilities were admitted and they were taken care of. So parents could leave them there and they would be looked after. At that time, we are talking about post-World War II US, where there was difficulties and both partners would be expected to be working if they were to make ends meet. So parents who had such children were deeply interested the children should get into an institution such as this. When this institution started, it was found that hepatitis outbreaks were common. This is because these children cannot be toilet trained well. So infections, transmission, fecal-oral happens frequently. And there were medical studies conducted in late 1950s, 1960s, and 1970s. So what they did was they would ask parents who would come to admit their children to the institution and say that we have very little space. We'll admit the child if you agree that he would be we could use him, we could include him in our research studies in the first 1 year or so. And they would remain in a research wing for first 1 year, that we don't have space anywhere else. We have space only in research wing. They would they would feed to these new inmates live hepatitis virus using stool suspension from those who had recently had hepatitis. They had some very useful results. They were able to show that hepatitis was of two types: one which was spread through close contact or from fecal oral route, and one which was transmitted by blood, the so-called hepatitis A and B. They were able to show that once a person had had hepatitis, if they were re-exposed, they will not get repeat illness. They showed that administration of gamma globulin could prevent hepatitis A if it was exposure was of after gamma globulin had been given. So technically, these studies were extremely useful. The investigators justified their studies by saying, anyway, children, once they enter this institution, within 1, 2, 3 years, get acute hepatitis anyway. So we might as well do this, and that would anyway happen. So we are just preponing it, something that would anyway happen. And we are using this to get useful scientific information. However, the other side believes that consent was not really free, because when the parents brought a child, they would say that there was no space, which was true in the rest of the institution, and that they had space only in the research wing. So if you agree, then we'll be able to take them. And parents wanted the child to enter the institution, so they would agree to this. Also, remember, they also gave some people serum. Chronic hepatitis B would have developed in some of them. In 1970s, this became known to public. There was a public outcry, and then these studies stopped. Also, similar studies were done at other places in the US. Those were among adults. So they were adults who were, during the World War, expected to go into war. They were supposed to be conscripted into the army. Those who would say that they don't want to get into the army, they would have to do something else. They would have to do some other kind of public service, or they could get away from the army military draft if they agreed to be a part of some experiments where similar things that I described in these children were done. Furthermore, there was this immunologist and oncologist at Memorial Sloan Kettering who injected live cancer cells into human subjects, those who had some other disease, incurable disease, and also in people who were in jails or very old people. His point was that injecting doesn't matter because these are going to be HLA mismatched. At that time, HLA was not known, but when you take cells from one person and push them into the other, they would anyway get destroyed. And the idea was, do they get destroyed or not? So this was public knowledge. It was happening with public knowledge. So this is New York Times in 1956. But few years down the line, people started finding that this is wrong, and they started condemning this. So ethics change over time. The same person also in 1950s tested wild West Nile virus as a potential cancer therapy. He injected this virus into 100 patients with terminal cancer. For some diseases, there was good response. So he says in lymphoma, out of 8 patients, 3 improved. But some others, 5 others, had very severe West Nile fever. He, during his lifetime, also got a lot of respect, even after these experiments, which were criticized, of cancer injection of cancer cells, of injecting West Nile virus into people, was elected president of American Association of Cancer Research. But later, he fell from respect and he lost his honor. These are not the only examples. You can see this Wikipedia page on unethical human experimentation in US. So in the US, there were experiments done with biological weapons, radiation exposure, toxic and radioactive chemicals, surgeries being done, torture being done, especially with mild altering drugs. They were done in children. They were done in the guise of medical treatment, and many of those were supported by the US government. And similar things have been done in many other countries. And finally, we are not talking of very, very serious things. Sometimes research can appear to be very simple. So there are these experiments done in Sweden, the so-called wipe home experiments. In 1940s, dental caries in children were very common. Dental cavities were very common. It was suspected that this is due to sugar, but it was not proven. So there was this facility, Wipe Home in Sweden, which was supposed to be a facility of what they then called uneducable retards, meaning mentally retarded people, children. Beginning 1947, a group of inmates, about 700, were enrolled and they were fed copious amounts of sweets, including specially formulated toffees, which would stick somewhat better to teeth. This went on for 2 years, and it was found that of 660 subjects, 50 developed deterioration of teeth. They developed multiple cavities in the teeth, and the researchers thought that this was a very successful experiment. Depends on how you look at it. Then in 1949, having achieved this, they shifted back to a more normal carbohydrate-rich diet, and their deterioration stopped. This led to a recommendation in that country that children should eat sweets only about once per week rather than spread out over the weeks. Actually, in Sweden, there are these candy shops where parents take their children and allow them to buy sweets and eat sweets only on Saturdays. This is something that their society follows till today. On other days, children will not eat candy. So this is something based on this study. At that time, the study was done with a lot of support from the confectionery industry, because basically industry was trying to think that this will not happen. And they funded money, they gave chocolates and caramels. And when this was proven, the industry was not very happy. The researchers were under pressure to delay their publication. And so study was published 4 years later in 1953. And actually there was a public debate about why the results were published late. However, nobody raised question about ethics of the studies. Public thought it was okay. The dentist thought it was okay. But in 1990s, as principles of ethics changed, people have said this entire study was unethical and should not have been done. So that brings us to the dilemma. As a physician, we are supposed to do what is in the best interest of somebody is in front of us. As researcher, our commitment is we need to do what is in the best interest of the study, which is to get an answer to our study question, a valid answer, a correct answer, and quickly. And these may not always be well aligned. So what has been done is various bodies have tried to lay down principles so that medical research, which is in the interest of society, can be done while ensuring that it does not interfere with the principle that we should look after the best interest of the patient. So there is Declaration of Helsinki put forward by a group of doctors, the World Medical Association, and which has undergone many changes over years. And basically it is physicians who are trying to say there should be something we can do while being physicians, while not going away from our principles that we have or ethics that we have as physicians, but also fulfill our commitment to do research, to find things for mankind so that we can improve healthcare in the long run. There is Bellman report, which is the US document that was issued by the government, by a committee set up in response to the Tuskegee study. As I said, Tuskegee syphilis study was came to light that wrong things were happening in 1972. So after that, in 1978, the Belmont report was issued. And you'll hear about these principles: respect for people, which you will hear in the name of autonomy, beneficence, justice. Also, they said to fulfill these principles, we need to do informed consent. We need to look at risk versus benefit ratio and how subjects are selected so that we don't have vulnerable subjects. And you'll hear that from Vinita and in the next few days. We in India ourselves, the first policy statement was issued as early as 1980 by ICMR. Then there are revisions in 2000, 2006, and 2007, and you'll be hearing about them from other people, including Dr. Nandini, who will come in this course. So with that, I hope I have given you an overview of how medical research has evolved, how we have thought about how study designs have changed, and how we have realized that the objectives or the principles that a physician follow may sometimes contradict what is required for research. And we want to do both at the same time. And that's why we need some principles of or study of bioethics. I'll stop here. If there are any questions, I'll take those up. Thank you.